In this video, I'll explore the spread of misinformation during the COVID-19 pandemic in Bhutan. The increased use of social media platforms, lack of media and information literacy, and an information vacuum from the official sources have contributed to the spread of misinformation. The Ministry of Health has not only faced a health crisis but also an infodemic during the COVID-19 pandemic. According to the World Health Organization, an infodemic is an overabundance of information, some accurate and some not, that makes it hard for people to find trustworthy sources and reliable guidance when they need it. This misinformation includes fake treatments, incorrect prevention methods, and conspiracy theories about the virus and vaccines. As a result, some people receive wrong or delayed treatments, worsening their symptoms and causing avoidable harm or death. It also discourages many from seeking proper medical care and following safety measures like vaccinations and social distancing. Misinformation during the pandemic highlights several ethical violations, including the principle of non-maleficence or do no harm is a core ethical principle. Misinformation directly violates this by leading people to make harmful health choices, which can result in serious consequences such as shortness of breath, muscle pain, and even death. Secondly, beneficence, the duty to do good, obligates healthcare providers and officials to offer accurate and reliable information. When misinformation spreads, it undermines this effort, preventing the public from receiving correct guidance, such as using hand sanitizers and wipes in public places to stay healthy. Moreover, autonomy is about allowing individuals to make informed decisions. However, misinformation erodes trust and limits people's ability to make well-informed choices about their health. Lastly, justice calls for fairness, but who often face greater difficulties in assessing accurate healthcare information and services. The consequences of misinformation are users, society, and media platforms. Firstly, users who rely on misinformation may suffer direct health consequences such as delayed treatment or inappropriate self-medications. This can also lead to a general mistrust in healthcare system and a public health advice. Secondly, society. Misinformation can undermine public health efforts, leading to a higher infection rate and more severe health outcomes. It also erodes trust in institutions and can have a long-term impact on community health and cohesion. Moreover, social media platforms, which are often the vectors for misinformation, face ethical challenges in balancing free speech with the need to control harmful content. Twitter alone has 500 million posts of COVID-19 since the beginning of the year, and many of them are dangerously misleading. Failure to address misinformation can damage the credibility of these platforms and contribute to a broader societal distrust. Globally, misinformation during the COVID-19 pandemic has had widespread impact. In developed countries, even with a strong healthcare system, it has caused issues like vaccine hesitancy and delayed treatments. These nations, however, often have better resources for addressing misinformation through fact-checking and public health campaigns. In developing countries, where healthcare resources are limited, misinformation can have far more severe consequences, contributing to higher mortality rates and greater societal disruptions. To effectively combat misinformation, it is essential to implement a multifaceted approach that includes establishing fact-checking units within the Ministry of Health and collaborate with the international fact-checking organizations to verify the accuracy of health information. Additionally, launch targeted public health campaigns to educate the public about the dangers of misinformation and the importance of relying on the credible sources. Lastly, work with social media platforms to implement policies that reduce the spread of misinformation, such as flagging suspicious content and promoting verified health information. In conclusion, combating COVID misinformation requires fact-checking, media literacy, and public health campaigns and collaborations with social media to regulate harmful content effectively.